The nut that isn't really a nut. A closer look into peanut allergies, what happens during a reaction, and is there a cure? What is an allergy? An allergy is a damaging immune response by the body to a substance, especially pollen, fur, a particular food, or dust, to which it has become hypersensitive, and that's the definition from Oxford Dictionary. People with allergies have an overactive immune system that is meant to protect the body against viruses and bacteria. You can be allergic to various things like pollen, dust, animal dander, foods like peanuts, wheat, soy, shellfish, insect stings, and medicines like penicillin, and much more. Why do people have allergies? Doctors aren't too sure why exactly people have allergies, but allergies can be inherited. If one of your parents has an allergy, then you're likely to have one also. But if both parents have them, then your chances double. Even if your parents don't have allergies, there's still a chance that you can. Another explanation is the hygiene hypothesis. The hygiene hypothesis states that if a child's environment is too clean and they are never exposed to various microorganisms, then their immune system does not get the opportunity to strengthen and the child is more susceptible to allergies, meaning the child's immune system attacks more than just bacteria and viruses because they were never exposed to basic environmental factors. What happens when a peanut enters the body? Someone with a peanut allergy has specific antibodies. These antibodies are called immunoglobulin E antibodies, and they are produced by plasma cells. These antibodies are what makes someone with an allergy unique. After the IgE antibodies are produced, they bind to mast cells. A mast cell is a cell filled with basophil granules found in numbers in connective tissue and release histamine and other substances during inflammatory allergic reactions. When a peanut enters the body, it binds to the IgE antibodies, which then activates the mast cells. After the mast cells are activated, a wave of chemicals is released into the body, including histamine and serotonin. In the illustration, it shows the plasma cell producing the IgE antibodies, which attach to the mast cell. And when the allergen attaches to the IgE antibodies, the mast cell is activated and histamine is released. What happens when a peanut enters the body? After the chemicals are released into the body, symptoms arise. The release of histamine causes blood vessels to dilate, which results in rash, itching, and mouth swelling. The release of histamine can trigger the contraction of smooth muscles and the dilation of blood vessels that causes anaphylaxis. When the smooth muscles contract and the blood vessels dilate, vascular permeability occurs, and there's a drop in blood pressure. This causes less blood flow to your heart, slower heart rate, and your airways narrow. EpiPens, or epinephrine auto-injectors, are used to treat anaphylaxis. Directly after an allergic reaction, EpiPens inject a chemical called epinephrine that narrows blood vessels and opens airways. This helps reverse the symptoms of allergic reaction like wheezing, low blood pressure, rashes, and itching. Immunotherapy is a relatively new treatment that has been used to help combat allergies. It involves feeding an individual a small amount of their allergen over time to increase tolerance. Another name for this is also called exposure therapy. A study was done in Cambridge, UK by Andrew Clark. It involved 99 children ages 7 to 16. 50 of them were control and did not receive any peanut flour. 49 of them received peanut flour every day over a 6-month period of time. Every 2 weeks, that the dose of peanut flour increased. The starting dose was 2 milligrams, and the end dose was 800 milligrams, about 5 peanuts. At the end of the 6 months, 41 out of the 49 could tolerate 800 milligrams, and 24 of the 49 could handle 1,500 milligrams. A quote from a girl that participated in the study, Lena Barden, said, "A year after the trial, I could eat 5 whole peanuts with no reaction at all." Is immunotherapy a cure to allergic reactions? Is it possible to outgrow a peanut allergy? Yes, it is possible. 20 to 25% of children with peanut allergies outgrow them. When an allergy is outgrown, it is normally at the age of about 5 years old, and it is more common for a child with a peanut allergy to outgrow it compared to one with a shellfish allergy. Some facts about peanut allergies. More than 3 million people in the U.S. have a peanut or tuna allergy. Rates of peanut allergies tripled between 1997 and 2009, and 2% of children are allergic to peanuts.